Hi, my name is Vera Clark, and I'm going to be explaining to my patient today extracellular volume deficit, also known as ECV deficit. So, I want to explain a little bit what ECV deficit is to you, okay? It's really important that you have an understanding of what's going on. So, water and electrolytes must maintain a very delicate balance in order for the body to work properly. And what happens when an ECV deficit occurs is the body doesn't have enough water, and that creates an imbalance between water and electrolytes within your body. So, water can either be lost through excretion and not being replaced or replenished with intake, or you could not be getting enough intake of fluids. Both of these things can lead to this condition. So, like I said, when there is an imbalance between electrolytes and water, what can happen is when your body doesn't have enough water, this can lead to a deficit in fluid that surrounds the cells in your body called extracellular fluid. And it also can lead to your blood becoming more concentrated because there's not enough water volume. And when this happens, your body has a hard time functioning. So the signs and symptoms that you might experience if this is happening is that you might feel extreme thirst. You might feel tired, weak, lethargic, and you might even be confused. Maybe somebody around you who's close to you might be noticing that you're confused. You might feel dizzy or lightheaded when you go from sitting down or lying down to standing up. You might feel your heart beat fast. Your mouth might feel dry. You might see that you're not going to the bathroom and urinating as much as usual. And when you do urinate, your urine is a dark amber color. You might experience some weight loss. And some people even have a seizure from this condition. This condition is fatal if it's not treated, so it's very important that it's taken seriously, okay? So there's many causes of this. One of the first causes is kidney disease or kidney dysfunction. The kidneys are responsible for the filtration of water and the water balance in the body. Medications such as diuretics, which cause your body to shed water, could actually cause this condition because potentially your body could shed too much water, which could lead to the deficit. Alcohol and caffeine are diuretics also. A lot of people aren't aware of that, but they do cause your body to shed water. And if those are consumed in excess, your body can become dehydrated. People who are sick with excessive vomiting or diarrhea could potentially have this situation occur. They they're expelling more fluids than they're taking in, or they're not able to hold down fluids, and so their body can't absorb them properly. Victims of severe burns might also experience something like this. People who have an ileostomy placement are also at a higher risk for this condition because dehydration is a potential risk with that kind of condition, and that too can lead to ECV deficit. So it's really important that if somebody has an ileostomy placement, that they do make sure that they get probably even more fluids than somebody who didn't, because the ileostomy is located in a place in the digestive tract where a lot of water is absorbed naturally. So when you have a placement there, that water is not being absorbed like normal, and that can lead to dehydration, which can lead to ECV deficit. So we want to talk about how it's treated. The first thing your healthcare professional will probably do is have some blood work done. They want to look at your electrolyte balance and see what's going on within your blood. They might check your blood pressure, because with this condition, what will happen is your blood pressure will drop and your heart will beat harder. They also might do input and output monitoring, which means they're going to monitor and measure the amount of fluids that you're taking in, and they're going to be measuring the amount of fluids that you're taking out, so they can kind of make sure that what you're taking in is actually coming out. Or if you're in deficit, they want to see that your body's actually absorbing and keeping what you're taking in versus what you're putting out. So treatment for this condition, typically the first thing that they're going to do is they're going to replace the water in the body through IV infusion. They also will, if the patient is able, encourage drinking fluids to restore the balance of water and electrolytes in the body. You might be placed on a special diet that's low in sodium, because when there is high amounts of sodium, water tends to follow the sodium, so that potentially could lead to deficits in ECV fluid. Because these conditions usually occur with high sodium levels in the blood, they might want to hold off on a diet that is rich in sodium or has sodium in high amounts, because that could actually cause the blood to become even more full of sodium, which compounds the problem, if that makes sense. So the initial cause of the dehydration, which led to the deficit of ECV fluid, will need to be determined. And then once that's determined, they're going to try to treat and prevent that cause so this doesn't happen again, okay? One of the most important things, though, is you have to make sure that you're getting proper hydration. Recommendation is to drink 1 ounce per pound of body weight daily. So let's say you are 115, 120 pound female. You want to make sure that you get 115 or 120 ounces of water, okay? Do you have any questions? Okay, great. I'm glad I was able to explain this for you.